Hi, I am Christine Lee, Acting Associate Commissioner for Minority Health at the Food and Drug Administration. As we highlight ongoing efforts at HHS to support quality of life for a thriving sickle cell disease community, I am pleased to discuss one of our most recent projects related to sickle cell disease with Dr. Claudia Biquet, an affiliate professor at the University of Maryland School of Pharmacy. Dr. Biquet, thank you so much for joining us today.
Thank you, Dr. Lee, for having me.
Before we dive into your current project on sickle cell disease, can you please tell us a little bit about yourself and your career?
Yes, well, I am a physician scientist. I have worked in public health at HHS as Deputy Assistant Secretary for Minority Health, as Associate Director for Cancer Control Research at the National Cancer Institute, and in academia. My commitment to addressing health disparities and health inequities is related to assuring diversity and inclusion in clinical trials, as well as the importance of the community's view on health engagement, as well as ethical considerations in research. My background with sickle cell dates back to my college days in Southern California. The Black Pre-Med Club had a wonderful local physician mentor who was a urologist who suggested that we adopt a community project. And that project was related to sickle cell disease and sickle cell testing in the community in Pomona, California. The following year, I worked in the summer between college years in Watts, California, at the Watts Festival, and did sickle cell screening in tents at the Watts Festival with a new geneticist that had just joined the Charles Drew School and who would later become one of the Surgeon Generals. So I've had an interest my entire career, even dating prior to me becoming a physician, in equity issues related to sickle cell disease.
That's great, Dr. Biquet. Are there any projects that you have researched about sickle cell disease in the past, besides the ones that you've mentioned? If so, please tell us about them.
Some of the research in the past dealt with inequities and unmet needs for the patients who have tremendous medical and psychosocial needs. So those were some of the projects that we researched. It's well established that there's tremendous physical effects of sickle cell disease and its crisis, as well as the potential to lower life expectancy and even cause great disability. So those were some of the things that I looked at over the years, over the decades, about sickle cell disease to try to understand, including from patients and caregivers, what some of the key issues would be. But despite that, and many others researching the disease, there have been numerous unmet needs, which we're going to examine in the project.
Thank you so much for the background. What was the genesis of your current project with the FDA Office of Minority Health? And what led you to this work?
The strong influence for developing this project and submitting to the Office of Minority Health and Health Equity at the Food and Drug Administration was related to, one, the philosophy of the REACH Consortium, which is the rapid acceleration of advances in health equity and health disparities for communities of color, for minorities and underserved populations. So there's a philosophy there with the REACH Consortium that underlies all projects that we are doing. Second, and most importantly, in December of 2023, the Food and Drug Administration approved 2 cell-based gene therapies for sickle cell disease. Tremendously noteworthy advances in technology and care for sickle cell disease patients. Now, I'd just like to mention a couple of things since we haven't discussed it yet. With sickle cell disease occurs in about 100,000 individuals in the United States. It is predominantly seen in Black or African American patients. However, Hispanic and Latinos, South Europeans, South Indians, as well as Middle Eastern communities can experience sickle cell disease. For Blacks or African Americans, about 1 in every 365 births is will be diagnosed with sickle cell disease, and about a little over 16,000 of Hispanic Latinos will be diagnosed with sickle cell disease. Now, sickle cell disease involves a genetic mutation of hemoglobin. Hemoglobin is a protein or substance that's responsible for carrying oxygen to the vital parts of the body through the bloodstream and to organs. What happens with sickle cell disease is there's a mutation in this hemoglobin, and it causes the blood cells, red blood cells, to sickle or become crescent shaped. What happens with this sickling is that there can be blockages in blood vessels. There is a reduction in the ability to bring oxygen to the various key parts of the body, especially the organs. And the sickling can cause excruciating pain as well as increased likelihood of reduced life expectancy. These two gene therapies that were approved in December by the FDA, what they do is they are made from the blood stem cells of the patients. Those are taken out of the body. They are modified, put back in the body as a single infusion or IV one time, and then patients are followed to see if these sickle cell crises are reduced or completely eliminated. And that is a very simplistic description of these very technical advances in cell-based gene therapy for the sickle cell disease population. And as you can imagine, there are underlying unmet needs for these patients and their caregivers. This is an advance in the technology to potentially cure sickle cell disease, but obviously it's very, very complex. And so we want to assure that the patients, their caregivers, the community in general understands what the cell-based gene therapy is in order to make an informed decision about their potential treatment. In order to do that, it really requires engagement of patients and caregivers and the community at large to tell us what are the best ways to communicate this advance in medicine, but very complex information to the patients and their caregivers so that they can indeed make an informed decision about their treatment.
What are you hoping, Dr. Fakay, to achieve or discover with your new project with the REACH Consortium on sickle cell disease and gene therapy?
We are hoping for an outcome in this project that tells us what are the best ways to communicate this complex information, what is the most culturally appropriate way to communicate this information, and then what are the best channels to both educate and distribute what we anticipate will be new materials developed to go over what these gene therapies for sickle cell disease could mean to the patients. And that's critical. We know that there's tremendous advances every day in different aspects of science, but the key to assuring there is human and patient and community benefit is the adoption of strategies that can assist the patient and their caregivers, their parents' caregivers, in making informed decisions about which way they want to go with their treatment. And I would encourage the public to go to the Food and Drug Administration website, as well as the Office of Minority Health and Health Equity website. Critical free information where you can learn more about these complex new technologies.
Thank you so much, Dr. McKay. You mentioned earlier that your REACH project involves tailored, culturally competent communication and engagement strategies, especially for diverse populations. Why is this important?
Well, we're all influenced by our histories, our culture, how we learn. This is even more the case for diverse and underserved communities who have experienced longstanding disparities and inequities in health in general, as well as in accessing the benefits of science and medicine. And we've learned from communities that in order to promote education, knowledge, awareness, and adoption of advances in medicine and science, that it's critically important to tailor education as well as the communication channels that we submit this information to. And so, for example, some communities prefer radio. Some communities prefer print. Some communities prefer other channels for education. Many communities say that there are stakeholders and trusted gatekeepers in the community that also help them understand and adopt advances in medicine and health, and this would include the faith community. With our project, we are going to be working with faith community, of course, the patients, a caregiver, which includes parents for the younger patients' organizations, to determine from them what are the best messages, what reading level they should be, what languages they should be in, and any other cultural tailoring that is recommended to us. We have some ideas, but we always trust in the guidance of the communities affected by the particular condition. And so we're not going to make any pre-assessments, but have the community actually guide us. Without culturally tailored or channel tailored strategies, we will be likely not seeing a greater understanding of these technologies for advancing morbidity and reducing mortality in sickle cell patients. And so that's why the tailoring cultural population method of communication is so critically important.
Thank you so much for explaining that, Dr. McKay. When your work is complete, what do you hope people with sickle cell disease will get out of this research and your project?
The desired outcome is information and guidance on the best way to communicate the complex information related to gene therapy and sickle cell, the best channel for distributing the information, and the best communication strategies that will allow our REACH team and the Office of Minority Health and Health Equity to assure that the patients, the caregivers, the community at large are able to make informed decisions about this advance in medicine.
Thank you so much, Dr. McKay, for joining us today and for sharing your project, your insights, and your stories.
Thank you, Dr. Lee, for having me.
Produced by the U.S. Department of Health and Human Services.